Welcome to USA Global TV and Radio, where our mission is to provide education, entertainment, hope, and inspiration. USA Global TV and Radio connects you with experts and audiences all around the world every single day to help you succeed in business and to live a richer life. Visit us at usaglobaltv.com to learn about career and life-changing training and mentoring programs like the Listening Mentor. Subscribe to our newsletter to stay informed about our special programs and offers. Discover how you can become a guest on one of our shows or a host or producer of a USA Global TV and Radio show of your very own. That's USA Global TV and Radio, where the doctor is always in.
Hi, welcome back. This is Talking Heads on the USA Global TV and Radio Network, and our primary focus is on health and wellness. I'm red.olaughlin, and I'll be your guide through this next series of slides that we're talking about cancer, its causes, and what options are really effective in being able to address some of the issues that come along the way with cancer. So let me take a brief moment, and there we go. Got that set up. One more punch. Okay. Disclaimers. I'm not a doctor, never have been, never worked in the pharmaceutical industry. I'm a researcher. I love chemistry. I fell in love with it many, many years ago, and I use it almost, in fact, I do use it daily. I can't remember the last day I haven't done some level of investigation. Usually it's at the cellular level. Chemically speaking, I look for cause and effect relationships. Treat a cause, fix a problem. Treat a symptom, and you'll always be treating symptoms. But it's one of those things that I find true love. And if I'm sitting there reading something and it tells me that this particular kind of chemical does this, inhibits that, accelerates it, that's what I find fascinating. And that's what I try to capture and be able to pass on to others. Now, last week we had our first, this is a planned 6-part series on cancer, its causes and options. And I introduced the subject of Otto Warburg. I said he had a Nobel Prize in 1924. No, the actual real number is 1931. Just want to make that correction. But he spent a lot of his time in the 20s. But it's one of those things, if you go into Google and you just type in something, that's what you're going to get. But it's not always the right answer. It's not always the most sought out answer, but it's an answer. So if you type in causes of cancer, you're going to get something. And as I'm doing through here, I try to look at other ways that I can find things. My primary focus today is on fasting. So if I look at fasting as a treatment for cancer, fasting and cancer, those kinds of things will give me totally different results than if I just say causes of cancer, because you're not going to ever pick up fasting. Well, as I was doing my research, I like Dr. Berg, and there was a thing, I said, Dr. Berg and cancer. Well, there's our video came up with him and Professor Thomas Seyfried from Boston University. And that's how I got involved with this thing called cellular respiration as a cause for cancer, as opposed to the genetic theory that cancer is a disruption or mutation of the DNA. Well, yeah, the DNA is mutated, but did an outside force cause that DNA, or did something else? Well, from the molecular viewpoint, it's actually caused by your mitochondria misfunctioning that disrupts the DNA. And from all the research that I've looked, I think that's probably really what it is. But what happened was with Otto Warburg is that he said that glucose is the source of food for cancer. And he found that because glucose was just used at such an enormous rate compared to normal cells. So if you look at a tumor, it was using glucose like nobody's business. It's just sucking it up. But if you look at the normal cells next to it, just a normal usage was taking place. Well, they put people on, let's shut down glucose. Okay, let's put them on a starving diet, fasting. And they had a lot of success, significant success with treating cancers. But some of the tumors did not respond to that kind of treatment. So because some of it didn't work and some of it did, scientists, researchers went on a different path. And that's when they came up and says, well, what we're seeing is DNA that's mutated. Well, it turns out with the more modern research, one of the things that Varberg missed was glutamine. And when you look at glutamine as a source of fuel for a cancer cell, it's just like glucose. Some tumors prefer glucose, some prefer glutamine, some prefer both. So you starve a cancer cell of glucose. If it likes glutamine, it's still going to live. And that's part of the problem why the metabolic approach, respirational approach to cancer was kind of let hanging. And as I mentioned last week, there's over 20,000 published articles and a lot more recently in regard to that. But we have a problem in being able to continue that particular research because of the contemporary standard of care. We can't do something that doesn't meet our standard of care. And our standard of care for clinical studies on cancer says I have to treat somebody the way that we typically do. So chemo, radiation. You take those two out of the equation and you're really not going to be doing anything. So that kind of clears up, at least in my mind, a little bit from last week. I'm going to absolutely cover it in more detail. A lot to cover today. My focus is on fasting, insulin resistance, cortisol, and gut health. I know we're not going to cover them all today, but we're going to get as far as we can and then pick it up again. I said last week I was going to be missing this week, but in reality, next week there is no talking heads on cancer. So it's going to be the week after. So let's talk about fasting. Yeah, we all know what fasting is. You stop eating, stop drinking. Doesn't mean you stop drinking water. In some cases, you can say, well, tea or coffee is fine if you don't put sugar or cream in it. Basically, fasting is something that stops metabolic activity in our body. So if I take and squeeze a lemon into a little bit of water and I take a sip, well, that little bit of lemon in the water is not going to cause a metabolic change in our body. So I could actually have that. Now, if I gulp it down and again and again and again, slightly different answer because now I'm taking a lot of stuff in a very short period of time. But if I'm sipping my coffee, sipping my tea over a period of time, chances are I'm not going to have any measurable or significant increase in metabolic activity that's going to say the fast stops. But fasting typically, in many cases, results in weight loss. What you see first in many cases is water weight loss. I was on a Atkins diet living in Germany in the end of the 90s for a couple of years. And I would go down to Italy for a weekend. I would gain 12 pounds over a 3-day weekend. I'll come back and take me 2 weeks to lose it. It's all water weight gain. But to lose weight and actually lose fat and inches, that requires something a little bit more than a simple 1 or 2 day fast. Fasting improves our blood sugar significantly. It decreases inflammation in the body, always great. Reduces cortisol. As we'll see in the future, cortisol and cancer have a handshake agreement. There's a connection. There's so many connections we don't know. And unless you look up and say, well, does cortisol and cancer have an interface? Well, what about mTOR in cancer? What about uric acid in cancer? Just pick any topic and cancer and you'll find something. But otherwise, it doesn't really show up. Fasting induces autophagy. We talked about that the last 6-week program. We talked about lifestyle. Autophagy begins incrementally at about 17, 18 hours of fasting. And it's at 100% at 72 hours. I do a 72-hour fast every month at minimum. I did 90 hours at the beginning of Lent. I just finished Lent with a 90-hour fast. But it's one of those things I do every month because it does allow autophagy to heal. And what happens in the body? It gets into that stage of beginning starvation. And all of a sudden you're saying, I'm starving. Maybe I need to get rid of all those cells in my body that are not 100% functional. And it just kind of allows the body to repair itself, to fully rest. And if we don't allow that to happen, a lot of things can happen. So autophagy, just one last thought on that for those who didn't catch last sessions. Autophagy is when you allow all of the accumulation of junk and stuff that goes on in a cell, the normal metabolism, to be, you're basically opening up your blood vessel, allowing the trash trucks and the recyclers to drive through and visit every cell, collect all the garbage, take the stuff that's recyclable, go through a recycle system and put it back into the cell. So now you have the ability to utilize fragments of things that are now repurposed to be fully functional again. So you're taking the cell that is just filling up with garbage, with trash, and removing it and allowing it to operate normally again. So if you think about it, and cancer, it sort of makes sense that autophagy, if you allow it to just go on for decades, might actually allow some kind of disruption of the control of the DNA in the body. Normally, our immune system will make those changes and fix those little mutations. But if you can't get to it and you can't make that change, then we have a problem. But let's continue on here. Fasting, we talk about blood glucose. That is our primary thing when we're fasting. We're really reducing that. We're actually changing the body's fuel source. So if I'm fasting long enough, my body is going to just stop using glucose as a source of fuel and change over to ketones. So you hear the term ketogenic diet. It just means that your body is now being supplied by fat rather than sugar as its primary source. But we also know that fasting will reduce the tumor's glucose usage. So for those tumors that rely on glucose as a source of fuel to grow, you take that away, you starve it. What happens when you starve something? They shrink. They actually go back. And so for tumors that are dependent on glucose and not on glutamine, you can see some significant responses. And I'll talk about one or two down the road as we get there. And they're actually seeing, and again, I'll talk some more about it, chemotherapy, and you put a fasting either before or after chemotherapy. And there's a lot of things that actually do significantly improve chemotherapy's ability to be effective. Fasting limits the tumor, because you're taking away that growth ability. You're limiting growth. You're limiting the ability of the tumor to adapt. You're basically affecting its own survival. Now, one of the things that fasting also does is it suppresses IGF-1, insulin growth factor 1, suppresses insulin, and many more. It's amazing how many things fasting does take care of. But it also increases your sensitivity. We know the term insulin resistance. Well, the other end of the spectrum is insulin sensitivity. If we have a choice, we want to be very, very sensitive to the level of insulin we have in there. But IGF-1 and cancer, very, very strong affinity between the two of them. Now, if I'm looking at cancer and trying to say maybe it might be an effective cancer treatment, can I say that? Well, here we have a lot of problems. We have our appetite. We want to eat. But if you have cancer, you don't feel like eating. You just kind of blasé. Fatigue, especially if you're going through any kind of chemo or radiation, your body feels differently. My wife went through this, and we had this, I'm not going to say a battle. We had a constant conversation with the oncologist because of her weight. That's the first thing they do is they come and they weigh you. They want to do a blood test. Well, what are your white cells like? What are your platelets like? But when you look into a hospital environment, hospitals do not, you would think they do not provide adequate nutrition for most people. Malnutrition in a hospital is a common thing, more common than what you would think. We lose our appetite because of whatever disease we have. We lose our appetite because we're sitting around in a hospital. Drugs have a major effect in it. Hippocrates says, our natural ability to fast fixes a lot of issues with disease in our bodies. Now, we have a problem with understanding, and we lump it all under fasting or malnutrition. Is it chronic or is it temporary? If I'm going to fast for a particular reason, let's say as part of my cancer treatment, as opposed to I'm chronically having a problem with weight loss, two different animals. If I lose weight and there's no reason for it, yes, be concerned. If I'm losing weight because I'm fasting, different animal, and it's temporary. If I can regain that weight by eating again, generally not a problem. So short-term fasting improves our immunity. However, most of the studies have been animal studies. Well, you take rat studies, there's a lot of stuff there that's similar, but you got to factor in the fact that if I'm looking at a metabolism in a rat, which is 7 times faster than a human, and I give it a certain dosage, there's things in there that I have to accommodate. So if I'm using from a metabolic perspective, not a genetic perspective in treating cancer, and I want to use some kind of fasting or food issue, I have to translate that. It's called transference, but I have to translate that to what kind of cancer does this person have? What stage is it at? How widespread? What is this person's health? What's the weight? There's just so many different factors in there, and it takes some real skill to do that. So just saying to myself, well, I got stage 3 cancer, I'm just going to go fat. No, you need a professional to help you through there, but you also need some knowledge to ask questions to say, doc, what if we do this? And so long as you have somebody following you that you get agreement on, we can do a lot of things. I mean, I've had some knockdown, drag out studies with my wife's oncologist. We did talk for 2 or 3 months because of things that I thought he should know because of his position and things that I could provide tons of research. But anyway, doctors don't always know enough about nutrition because they were never taught. But the animal studies, lots of them out there. You'd be amazed at starving an animal and then feeding them chemo and then starving them after. The amazing results that are there. White blood cells, killer cells increased, all the things that you want to have happen, but they don't happen if you just give them the chemo and you feed them. It's super interesting in the fact that starve them a little bit and you get so much better results. One particular case that I looked at, natural killer cells are something that our immune system uses, and typically we're attacking inflammation in the body. So I have an infection, take our last pandemic. Natural killer cells are what's going in there to attack that particular virus. But if I do a 2-week fast, and whether this is water only or a very reduced caloric restriction on that, or I'm using a 1 meal a day where I'm having a significant reduction in food, that fasting actually leads to about a 24% increase in natural killer cells when you're looking at the blood results from the people involved. So, as I said, the natural killer cells are primarily there to attack infection because that's part of our immune system. That's what we do. That's how we work. But cancer cells are not part of our normal system, and NK cells will actually attack the cancer cells, and that's what we want. We want our body, our immune system, to counter that. Well, in most oncologists' minds, we have a problem. Weight loss means wasting away, means we're doing everything in our power to counter the effect of chemo by losing weight. And there's a term for it. It's called cachexia, wasting syndrome. And literally 20-40% of cancer deaths are from wasting away. We're not eating. We just don't feel like eating. But cancer cells have a voracious appetite. They're going to eat whether you eat or not, as long as you have some level of food in your body. So if we're feeding our body, we're providing a source of enjoyment and growth, expansion for our tumor. There's a thing called parenteral feeding. That's where you have a stomach tube or you have feeding through an IV. And a lot of cancer patients can't eat for a number of reasons. Let's say you have esophageal cancer, they're going to be feeding you some other way. But when they start looking at the results of, okay, let's keep that person, we have to keep their weight up. So we're going to add them, this particular one. Well, there were 26 randomized tests that I looked at, all done with some kind of parenteral therapy. In other words, a IV drip or whatever it may happen to be, a stomach tube. And in every one of these cases, there was not a single evidence that that kind of feeding had a beneficial effect on the cancer, on the treatment. It did increase complications. It decreased the tumor's response to chemo. In other words, you hear this thing, Ensure. I see these little containers. A lot of family members and friends kind of live on Ensure because they can't eat a lot of other foods for whatever reason. But there was no survival advantage. If I look at healthy cells versus normal cells in fasting, I get a stronger, healthier cell when I'm fasting. But if we put that before and after chemotherapy, there's a significant measurable amount of things that happen. Let's move right along here. So if I want my cancer cell to slow down its growth. I remove the glucose. So I know the cancer needs that glucose. And let me just focus for right now on glucose rather than glutamine. So I can limit the growth by shutting down, starving. But when I do my traditional chemo treatment, we find out that when you look at all of these things that they're treating, breast cancer, colorectal cancer, all these different kinds of cancer, you add in an extra little amount of fasting. That fasting has an effect on how that chemo drug works in that particular environment, in that tumor. Tumor cells are more sensitive to chemo when you fast ahead of time. And the fasting, ironically, protects the healthy cells from the chemo. We have these things called tyrosine kinase inhibitor drugs, and it works on the ability of the cancer tumor to take in the chemo. And so they're trying to make a drug that simulates fasting. But with short-term fasting, we're talking 24, 48, 72 hours, there is a major, major improvement in the ability of chemo to do its job. Now, in some cases, and one of the guys that I followed for years, the main reason I go on a 72-hour fast every month, and sometimes it ends up 100 or even 200 hours, is the fact that I like the ability of my immune system to be basically regenerated from scratch. Well, Dr. Walter Longo out in University of California, I think Southern California, he came up with the 72-hour fast and what it does for the body. He's also come up with a 5-day fast in which it rebuilds our pancreas beta cells so you can start addressing some of the issues of diabetes and insulin. But when I look at, and what he has found out there, when they combine fasting and a 72-hour fast, particularly with breast cancer treatment, chemo, they found that in reality, a 72-hour fast was almost as effective as chemo itself. Now you add the two of them together, they become synergistic. Now, because chemo happens, every other week, every week, however, whatever sequence you're on, radiation almost happens every day. So if you're going to try to do something with radiation, maybe an alternate day fasting is something you need to talk to your radiologist about. But they noticed that when you add fasting before and after chemo, that the side effects, the nausea, all the brain fog, all the stuff that you typically have, those symptoms, they don't go away, but they're greatly reduced. So they started doing some testing. Well, if I do this 24 hours, what happens? So I get a bunch of people, have a test, and okay, we're going to do a 24 before and after. We're going to do a 48 before and after, do a 72 before and after. Well, they found out that 72 hours seems to be the magic number, that it's not really, you don't gain a whole lot more beyond that, but there's significant improvements from 0 to 24, significant improvement. 24 to 48, again, same thing, 48 to 72. So fasting does have a time dimension attached to it. So if I want to improve the results of my chemo, fasting for 72 hours before is a major significant improvement. I get better immune response from my chemo into my tumor when I add fasting to it. Does that mean that maybe what I could do is change the dosage, maybe double or 50% more? Some of the toxic side effects aren't being seen because the fasting takes them away. A lot of options available when you start incorporating fasting as part of that. And there's a lot of studies out there, a lot of published studies. So if your oncologist doesn't have that, that's something you probably really need to sit down and look at. I mean, I can find them myself. There's no reason a doctor can't find them or his staff can't find them. But most of the clinical studies are done on animals because we just don't approve a lot of that stuff so far on people. But there are a lot of options in there with regard to doing the dose and the level of toxicity for each person. Let me change that one more time there. So now we come down to the deal, to fast or not to fast, because the human studies aren't really there to support it. But if I go with a reduced chemo level, in other words, instead of, let's say, 100 milligrams of this particular drug, I go down to 50, well, that's going to make the patient feel better because we're not being inundated with all this toxic stuff. But then you still have to counter the official guidelines. I don't want my patient to be malnutrition, because if they go on a 72-hour fast, they're not getting their nutrition, and the mindset is they can't lose weight. They have to have all the nutrition. My wife's oncologist was absolutely concerned about uh, calcium getting into the bones. That was our primary headbutting. And I told him, doctor, just taking more calcium doesn't get into the bones. Well, he was not only an oncologist, but also a blood specialist. That was one of his deals. And I told him, you got the magnesium to get the calcium in there, but you got to have the vitamin D3 and the vitamin K2. And those are two areas that he was not necessarily just by taking have your wife take more calcium. No, that's not the answer. I said, you have to have these other ones. Well, I said, I'll have her get more calcium, but it's not what you're saying. So anyway, he didn't like people telling him no, but regardless. But the prolonged fasting, and prolonged basically means about a 72-hour fast. You have to ask yourself, if I'm already 60 pounds underweight, I'm not a good candidate for that kind of thing. You have to be sensible in what you're doing. If I'm at or near my regular weight, maybe I've lost 20 pounds because of this cancer, I'm probably a good candidate. Probably can do those things. If I can regain the weight after my cancer treatment, yeah, I'm a good candidate. But there's also another thing out there too, FMD. That's called fasting mimicking diet. And that might be a way. Now, I was on a show the other day with somebody, and she was hypoglycemic. She couldn't fast. Well, maybe a fasting mimicking diet is one that will allow somebody to fast by eating, because our body, we're eating, but the body doesn't look at it the same way. So it might be something to do. But again, if you can regain the weight after your chemo, fasting might be an option for you. So temporary weight loss, no issue. Fasting mimicking diet, and they're trying to get a drug that mimics the fasting mimicking diet, just like they're trying to get drugs that mimic fasting. Well, in the medical world, a drug is an approved way of doing things. You start talking about food doesn't have testing, so it's not one of those things that they do. But insulin growth factor, we talked about it earlier, IGF-1. The levels of IGF-1 go down. And when they go down, it also affects the level of the drug. So if I have a chemo drug and I can measure my IGF-1 levels very easily with blood test, as the IGF levels go down, the drug effectiveness actually goes up. There's a reverse. You would think, okay, everything's going down. No, the ability, because that fasting increases the drug's effectiveness as my IGF levels go down. If I maintain my IGF levels by certain kinds of foods, which I can do, then the level of drug effectiveness goes back down again. So it's they've proven it's actually a matter of fasting reduces blood glucose, it reduces this, but the IGF-1, if I'm choosing certain foods, then I raise that back up and it kind of limits my effectiveness. So proteins are one of those things that increase IGF-1 levels. So is reducing protein an alternative? Well, again, it's based on many, many things. Is it a plant protein? Does a protein have toxins in it, such as hormones and other things? Lots of issues with red meat, with all different kinds of things. So it's not a simple yes or no answer like turning on a light switch, but it is something that we do need to look at. But it may be predicated that using fasting mimicking diet as part of the protocol in lieu of or in condition with fasting mimicking diet. Now, the fasting mimicking diet is fairly simple. Plant-based, low carb, low protein, caloric restriction, 600 calories the first day, the next 4 days, around 300 calories a day. But you do that only 5 days out of the month. And they tested 101 cancer patients with, just a wide variety of tumors. And they found out that the tumor infiltrating immune cells increased, fewer side effects. So the fasting mimicking diet worked very, very nicely. Now, you see similar things with the fasting and the chemo, but I'm looking at my time, and I think this might be a really good place to wrap things up. Let me just go ahead and finish up here on this one. Talked about standard of care, stops most human studies, but they've noticed with survival rates. Now, we talk about, did you survive cancer 5 years, 10 years? But survival, cure, and manage are three different thoughts in our brains. If I survive something, okay, was I healed from it? Was I cured? Or maybe I'm living a healthy life and I can manage whatever level of cancer I have. Because you can't do this managed care clinical studies in the state because we don't allow it. Places like Turkey, Istanbul, Cairo, they only accept stage 4 cancer patients, and they have in the metabolic treatment, Otto von Warburg's kind of treatment, where they can contain both glucose and glutamine. They've seen 80, 85, 90% managed care of stage 4 cancers. But again, it comes in, if you're 100 pounds underweight and you've been fighting this thing forever and you've been through just bouts of chemo, you can't expect 100%, 90%, 50% success. But what they do over there, because the chemo has to be used in some recognition, they'll use 75 or 90% less dosage of a chemo drug and then add in the metabolic portions that are prescribed for that particular patient's health and cancer. Cancers live in an oxygen-free environment. They don't like oxygen. You can put them in a hyperbaric oxygen chamber. In other words, just pressurize oxygen so it just infiltrates every part of the body. But the reason that they're not really pushing this thing right now is they're still collecting research. They don't want to end up with another situation that Otto Warburg had. It's the fact that all of a sudden there was a surprise. Cancers use glutamine. Well, if they're attacking glutamine and glucose and they're having 90% success, or actually they're having 100% success on seeing the treatment of the cancer go away, is there a cancer out there that we don't know about right now that will not respond? And that's what they're concerned about. Are there untested tumors that's going to prevent us from being able to say, hey, this is the way of the future? So given that being the case, we're going to start down. That ends very nicely with fasting and metabolic treatment. So next time we pick up, we'll be talking about insulin, and we'll go from there. So Dr. Jacqueline, appreciate that very much. Let me go down here very quickly to the very end of the slide so I can end up this. My website's red.olaughlin.com for those people on audio, red, REDOLAUGHLAN, red.olaughlin.com. You can reach me by email or my phone number. Just give me a call. That's in my website. I have 4 books right now available on Amazon and on my website. No matter what you can do it is a book on the subconscious mind. The Joy of Ageless Health talks about the primary causes of disease and what we can do about addressing each one of them. Longevity Secrets for Healthy Aging talks about 2 causes of aging and what we can do to accelerate or decelerate the aging process. And my book out now just about a month ago is called Understanding the Causes of Alzheimer's Disease. And based on what I'm doing right now with cancer, I'm thinking there's going to be a new book out in the not too distant future, Understanding the Causes of Cancer. And so with that, I am going to conclude for this week, and I will catch you all again in 2 weeks. So have fun and enjoy, and we'll catch you later on. Bye now.